Hello, my name is Briana Beyerl. This is my final project for my wellness class, IDS 402 with Dr. Searight. This oral presentation is on a subject that hits very close to home for many people, but it isn't often talked about. The topic is depression, and according to the World Health Organization, it affects about 350 million people globally, resulting in about 1 million suicides annually. Under most circumstances, depression affects a person's emotional wellness. However, depression can manifest itself physically, causing the afflicted individual to become ill or to have aches and pains without reason. Depression also has a massive impact on social wellness, as oftentimes someone who is depressed doesn't want to leave their home or deal with any other individuals. There are several types of depression, as well as a vast amount of causes and a wide array of treatment options. This presentation will examine the topic of depression and analyze treatment methods through the scientific, philosophical, and environmental interdisciplinary lenses. Now, there are many different types of depression. First, there's major depressive disorder. This is where the individual's symptoms are debilitating and affect a person's daily life. For example, they can't get out of bed. There's persistent depressive disorder. In order for a patient to be diagnosed with this ailment, the symptoms must last for 2 years or more. Next, there's psychotic depression. This is severe depression with a psychosis. And the psychosis can be anything from disturbing beliefs, delusions, or even hallucinations. There's postpartum depression. It affects about 10 to 15% of women, and researchers have found that it's mostly due to physical, hormonal changes, and as well as feeling overwhelmed by the new baby. Seasonal affective disorder usually strikes during the winter months, and for most people it will resolve itself when springtime comes. And finally, we have bipolar disorder. This is when the affected person has extreme highs and extreme lows. While there isn't a singular cause of depression, several factors can be involved. And this includes biological differences, brain chemistry, hormones, inherited traits, and life events. Now, there are many symptoms of depression. Some of them include sadness, irritability, a loss of interest, changes in sleep patterns, for example, sleeping too much or sleeping too little, appetite changes, and this could be eating too much or eating too little, trouble concentrating, feelings of worthlessness, aches and pains, and suicidal thoughts. Here we'll take a look at depression through the scientific lens. Now, scientists have many treatments for depression. Researchers have come up with many different treatments and are constantly trying to find more. The first is SSRIs. These are the most commonly prescribed drug for depression. They increase an individual's serotonin levels. Some examples are Prozac, Zoloft, Paxil, and Celexa. Next, there are SNRIs. These are the second most commonly prescribed drug for depression. and they increase the serotonin and norepinephrine levels. Examples are Effexor and Cymbalta. We have NDRIs, and these block the reuptake of dopamine to increase their neurotransmitters in the brain. An example of this drug would be Wellbutrin. Wellbutrin is often prescribed to cigarette smokers to help them quit. Now, although these medications are necessary in many cases, they do have some nasty side effects, and oftentimes patients will discontinue taking their medicine because of the side effects. So researchers and scientists are constantly trying to find better ways to treat depression. In 2013, a psychiatrist named James Murrow published a study on off-label ketamine use. This is a psychoactive illegal drug. However, his study had 73 participants and found that 64% of the individuals had their depression reduced within 24 hours of treatment. And researchers at McLean Hospital are studying low field magnetic stimulation. It uses low-strength, high-frequency magnetic fields, and results are immediate. There are no side effects, and it's legal. Here we have treatments of depression through a philosophical lens. Now, the top one is exercise because it releases endorphins and gives a person kind of a natural high. Diet change can help a person who's suffering depression. Eating foods that are high in omega-3 fatty acids, healthy fats, and a diet that's rich in protein is often suggested. Yoga and meditation can help a person relax and can help ease a person's anxiety when they're going through depression. An individual should definitely have their hormone levels checked, as thyroid, adrenal, and sex hormones can play a role in a person's mental state. Acupuncture is said to help, and psychotherapy is another excellent treatment to depression, as a person can talk about their feelings and what they're going through instead of keeping all of their emotions bottled up. And therapists can help an individual work towards resolving their problem. Psychotherapy has no side effects, and there are many low-cost therapy services all over the country. There are many environmental causes of depression. Chemicals in food preservatives, pesticides, hormones, and drugs have been linked to depression. Seasonal changes have been linked to depression, such as we saw in seasonal affective disorder. Natural disasters such as hurricanes, earthquakes, and tsunamis can play a role in someone's mental health. Some medications can trigger depression. Some of these include medications that are used for acne, high blood pressure, birth control, Parkinson's disease, inflammation, and gastrointestinal issues. Many chronic medical conditions can be linked to depression, such as diabetes, pain conditions, thyroid problems, neurological issues, stroke, heart problems, and sleep disorders. There are other environmental factors that play a role in a person's mental health. Some examples are an individual's living conditions, the relationships an individual keeps, stress, traumatic life events, and unresolved problems during childhood. This concludes my presentation on depression. And again, this is for my wellness class, IDS 402, with Dr. Searight, and my name is Briana Beyerl. Thank you.